Well, the 4th of July is right around the corner, and we know that that means fireworks. But let's make sure you're taking the proper precautions before someone gets hurt. Dr. Patrick Scott is an optometrist at UofL Health, an expert, unfortunately, here in some of the worst cases, because we know a common injury from fireworks is eyes.
Correct.
And that's just terrible. So tell us a little bit about this. What exactly is happening? What are you seeing people coming to you with injuries like?
So, it's a good number of patients that will come in that can have an eye injury. So the types of injuries that are going to occur with a misfiring of a firework is likely going to either be a chemical burn to the surface of the eye, could be a thermal injury that could happen, an abrasion to the ocular surface. But one of the worst things that can happen that's most severe is that you can actually get a ruptured globe or a ruptured eyeball, and that can cause retinal detachments. And those are all things that could lead to permanent blindness if not treated.
Okay, very scary to hear all of that. So if someone does come to you with one of these injuries, what can you do?
So we're going to give them, an assessment and look to see what happens. So I will tell the patients, basically you ask them, what were you exposed to? How did this happen? So you want to do a good case history and make sure, what were they, so if they were exposed to, like, for instance, a sparkler. Sparklers can burn at approximately 2,000 degrees. So you're looking at something more of like a thermal burn. So we're going to do a complete assessment of the eye, look at the eyelids, the face, and things like that. Now, I will tell the public that if this does happen to you, it is an emergency. It's a medical emergency if you have a firework that, that something goes wrong and it blows up or something like that and the eye is involved, is to not rub the eyes, do not rinse or flush the eyes, do not put any types of ointment in the eyes, do not take any medications that are going to thin the blood until you've been seen. So the best thing to basically do is to cover the eye with, say, a cup if you have something like that, or a shield, and do not apply any pressure, because if there are particulates from the firework that have gotten into the eye, you may make a bad situation worse.
That's a really good heads up, because flushing, things like that, that's like kind of your first thought, right? With an eye injury. Okay, we only have a few more seconds, but you have a prop for us. I love it. Make sure you tell people about this and how they should use it.
Okay, so if you're going to be partaking in fireworks, over the 4th, you want to get a pair of safety glasses or safety goggles that have this little ANSI approved. So the ANSI is basically the American National Standards Institute, and I like these particular goggles because they will securely fasten around the face and the nose and protect you from any particulates. So as long as you're wearing something that's ANSI approved, particularly those that are going to be more snug to the face, you'll get maximum protection.
Excellent advice here. Thank you so much for coming on.
Thank you.
Perfect timing ahead of this weekend, and I hope you don't have any crazy injuries when you get back to work next week.
I hope not either. Thank you.
All right, thanks so much.